with breastfeeding, there are so many benefits, short-term, long-term health benefits, not only for baby, but for mom. So why don't you walk through some of those benefits for mom and baby?
Okay, so for moms, an important thing to know first is that the benefits that they receive are dose related, meaning it depends on how long they have breastfed in their lifetime. So we hope that moms will remember that they have a reduction in their risk of heart disease, postpartum depression, osteoporosis, type 2 diabetes, obesity, and so many things. Oh, breast, ovarian, and uterine cancers as well.
Wow.
And then for infants, we see a decrease in risk of middle ear infections, respiratory infections, SIDS or sudden infant death syndrome. There's a dramatic decrease in the SIDS risk for babies who receive breast milk. Also in childhood cancers, so many benefits. And then for our environment, that's an important thing to note too, that breast milk we say is green or ecological. It does not create any waste. And the only energy that it uses are fat stores that moms have laid down during pregnancy for the purpose of lactation. So moms can breastfeed or pump and burn 500 to 800 calories a day. They love to hear that.
Yes.
Just nursing or pumping for their babies.
And, you know, a lot of the times you mentioned calorie, how many calories they burn, so that means you got to intake a lot more calories. And so I think what was surprising as a new mom, knowing how hungry and thirsty I was all the time, and that's not uncommon. That's a normal thing.
Yes, it is. So moms do need to know that they need at least 2,000 calories a day to maintain a healthy milk supply in general. And then there aren't a certain amount of ounces that we say to drink anymore, just for mom to make sure that she's well hydrated. And the hormone prolactin actually is mom's built-in reminder to make sure she's drinking because it makes her feel thirsty.
Oh, very interesting. Yeah, those are some great benefits for mom and baby. And so as a new mom, I know there's a lot of stress around breastfeeding. It can be very overwhelming. You're kind of, you don't know what you're doing, right? And so let's talk a little bit about the supply. How do you know your little baby is getting enough?
So 3 main things. We want to, in the beginning, count and make sure that babies are nursing at least 8 times every 24 hours. Often babies will nurse much more than that. And then we want to look at their output and keep track of every feeding, wet, and stool until babies are past birth weight, which would be usually about 2 weeks old, sometimes sooner than that. And then the gold standard of how things are going is infant weight gain. And so frequent weight checks are really encouraged, and we do those at our support groups. And then obviously at pediatricians' offices, moms will be having weight checks. An infant should gain minimum 4 ounces in a week. Often they're going to gain 7 or 8 ounces, and then breastfed babies cannot gain too much.
So based off of that, I remember when my little one was gaining 10 ounces a week, and I was like, wow, that seems like a lot. But you mentioned that over time, it'll level off. So they may gain a lot in the beginning, and then they'll kind of level out. So that's kind of normal then.
Usually for the first 4 to 6 months of life, they'll be having that anticipated weight gain of 4 to 8 ounces a week or more. And then at 4 to 6 months, it usually drops off. And that's when they start to lengthen and stretch out and not bulk up as much as they were the first 6 months of life.
Okay. And we were talking earlier a little bit, and you said one of the most common things that moms come to you with is it hurts. So what advice do you have to moms about that, the initial discomfort, that tenderness that comes along with breastfeeding?
Okay, so sometimes, typically in the first few days of breastfeeding, moms are going to experience some topical tenderness. Colostrum is thick and sticky like honey, which is baby's first food, and it's amazing. But babies have to suck really hard to get it out, and so that can make moms topically tender. So after milk is in, it's more fluid. Usually babies don't have to suck as hard, and things should get better. Sometimes when mom's milk first comes in, they're overly full or engorged, which makes latching a little tricky. And so lactation consultants work with moms to help them deepen baby's latch. When baby's latched on nice and deep, then we shouldn't have continued soreness.
That's good to know. And if you're just joining us, we are here with Marji Stark, lactation consultant. And please feel free throughout this time to enter your questions. We'll be going through and reading some and answering those questions if we're not covering maybe a topic that you're interested in or need some help with. So with that, supply in early days can be very stressful, like we mentioned. And even myself, sometimes you have to supplement with formula, even though if that's not your plan. So let's talk about supplementing and the many reasons why moms might have to supplement, and that doesn't mean you won't be successful at breastfeeding after.
Yes, exactly. So quite often there is a medical indication for early supplementation, and those would include things like baby maybe having low blood sugars, baby having hyperbilirubinemia or jaundice, a level that's concerning, or baby losing weight a little too quickly before mom's milk is in. So those would be 3 medical reasons that probably a pediatrician would say we need to supplement. We love to supplement first with mother's own milk if we have it. So we would have mom pumping, and then we would breastfeed and then top off with her own milk. Sometimes in the early days we don't have that extra milk yet, and so then we would use a safe formula.
There you go.
Yeah.
And so
and then I should say, anytime we supplement, we would have moms pumping at that time too.
Right, to still help the supply.
Preserve supply.
So talking about supplementing, and if you have to go the route of using formula, what is kind of the different makeup between breast milk and formula?
So such a great question. Formula is infant nutrition, and it is always the same. So we are so thankful that we have safe formulas in the U.S. When that is necessary, or when it's mom's choice to feed her baby. But breast milk is dynamic. It is living tissue. Every feeding is different. It's loaded with living antibodies, fats, carbohydrates, and proteins. Every feeding is different, and so it's very different than a stable formula. And one of my favorite things about milk, mammal milk, is that it's species specific. So that means that a mother horse is making perfect horse milk for her foal. Cat milk is perfect for kittens, and human milk composition is perfect for little humans, and every single feeding is different.
Yes.
So it's amazing.
Yes, and we do have a question from Joe, and he's asking, as a dad, how can he support his wife through her breastfeeding journey? Because a lot of times dads don't know what to do.
Yes, yes, such a great question. So the number one reason that women don't meet their breastfeeding goal is lack of support from a significant other. So it's a wonderful question, and yay, Joe, that he's thinking about supporting mom. The first thing to do is go to breastfeeding class with mom, and so that dad can learn exactly what mom is learning and be ready to support and advocate for her when needed. And then second is support her well in the hospital, and then go to support group with her after discharge. We often have daddies come to group, and we love that, and then they're getting, again, the same information that mom is getting. And then when they're at home, dad can be in charge of bringing baby to mom to feed, bringing her water, bringing snacks and pillows, and then dads can do skin-to-skin time with babies. That works wonderfully. And often I encourage moms to ask dad to be in charge of bath time. That's a wonderful skin-to-skin time for babies and dads. So lots of ways, and just being her best cheerleader, just telling mom how proud he is of her for working so hard to provide.
You're doing a great job.
Yes, that makes a huge difference.
Knowing that and just hearing that can do all the difference.
Yes.
We do have a question a little bit more specific this time. So this person is asking, Karen, I believe, is asking, her little one's 7 weeks old, and she's exclusively breastfeeding. And until now, everything's been fine. But now she's hearing a popping sound when her little one's nursing. So why is that happening?
Sometimes a little popping or clicking. If everything else is fine, we don't really worry about. So if baby's gaining well, and if it's not hurting, she didn't say it was uncomfortable, it could be totally fine. Sometimes constant clicking or popping could be related to baby thrush. Maybe their mouth is a little bit itchy from thrush, and so we would want to peek inside, have pediatrician actually look at baby's mouth
Make
to
sure
see,
everything's good.
to make sure everything is fine. But in general, if there's no pain and if baby is thriving and gaining well, many things are okay.
Perfect.
Yes, baby could just be playing around.
Yes. And please keep your questions coming. In the meantime, let's talk a little bit about normalizing breastfeeding and really the support after discharge that is really important and makes a big difference for moms.
So support after discharge is huge in successfully reaching breastfeeding goals. So at St. Luke's, we provide support groups, at our different entities, and we encourage, again, families to attend those. We do offer as well phone helping every day. We do lots of phone helping, and then there are online communities where moms can connect and find help that way as well. Coming to a support group and seeing many women nursing babies and children of different ages helps normalize breastfeeding in our mind as a new mom. Maybe they've never seen that many babies nursing. And people can come to group and not breastfeed there if they're not comfortable. That's absolutely fine. But coming to group helps normalize breastfeeding to mommies, and it helps them actually breastfeed longer, because that again becomes normal.
Right. And since you brought up our lactation support groups, it's not just for moms who are breastfeeding. It can be moms who are supplementing. It can be moms who have already ended maybe their breastfeeding journey and are now just using formula.
Yep, totally. Everyone is welcome. So we have moms that are exclusive pump and bottle mommies for whatever the reason is. That's their choice. We have moms exclusively nursing. We have moms nursing twins right now, which is wonderful. We have mommies that are tandem nursing, which is nursing 2 children of different ages. Sometimes that's the situation. Pregnant mommies are more than welcome. And again, like I said, dads, we love it when daddies or companions come. So yes, everyone is welcome. And if they're supplementing, they are more than welcome to be part of our group.
Perfect. So along with this breastfeeding, you're going to have to pump at some time, at some point. So with pumping, let's talk about when moms should begin pumping and maybe some reasons why they should start pumping, whether it be going back to work or anything like that.
Sure. So pumping in general, the American Academy of Pediatrics currently recommends that moms delay pumping until 4 to 6 weeks to start pumping for returning to work and introducing a bottle of breast milk to baby. And that's to let baby get off to a great start imprinting on the breast. Bottle feeding breast milk is easier, and our babies are so smart that if we give that early, they quickly figure that out, and it could make returning to breast difficult. So other than that, some mommies need to pump a little in the early week just because of being overly full when their milk comes in. And that is fine. So pump early if you need to for comfort, just to soften the breast. And then we usually say wait until 4 to 6 weeks to start pumping, usually once or twice a day after feeding, and then date that milk and freeze it to prepare for returning to work.
That's perfect. And we just had a quick question from Ashley. She said, I hear both that breastfeeding shouldn't hurt and also that the first few weeks it does. She asked, when should I expect when my baby, I'm sorry, I can't see that. When should I expect when my baby comes? With my first, it was very painful at the first few weeks. So really we say that those first few days that topical tenderness is normal, but that should go away after the baby gets going breastfeeding, really the first 4 or 5 sucks, and then it should feel like strong pulling, tugging. If it continues to feel pinchy or like biting, that means we need to get baby deeper on the breast. So if we often hear from moms at support group, they wish they'd come sooner. And so I would say to this mom that really, if things are still uncomfortable after the first few days, come to group, call the lactation office, and come in and let us work with you on positioning and getting baby latched a little bit deeper. It should not hurt for weeks, ideally. Yes. So we talked a little bit about the pumping to get ready, going back to work and reasons why. But before you go back to work, you have to start introducing a bottle at some point. So when do you start introducing a bottle? There's a lot of talk about nipple confusion. So when's ideal and who should do it?
So we used to actually say nipple confusion. Now the term I like is nipple preference.
There we go.
Because the babies, again, are smart and they prefer an easy, firm nipple. A mommy nipple takes more work. So that's the reason we delay. So 4 to 6 weeks is the right time. Typically, there's a little window there where they're typically more receptive to taking mom's milk another way. And then usually it's going to be best given by dad or grandma or someone other than mom, because it's confusing to baby. Some babies honestly will take milk from anybody anywhere. And so they might take it from mommy. But more babies seem to be receptive. Plus, it's kind of fun for dad. He's been waiting to get in there. And so it's a good time that he can give that milk and have a part of feeding too.
Dad and baby time.
Yes.
Now, quick question is pacifiers the same way? Should they delay giving pacifiers so that there is not a nipple preference?
Yes, so that actually, again, the American Academy of Pediatrics is recommending delaying artificial nipples in general. So that would be bottles and pacifiers for the first 4 weeks of life or until breastfeeding's well established.
Yeah, perfect. And please keep your questions coming. If you're still joining us or if you're just now joining us, I'm with Marji Stark, lactation consultant with St. Luke's Health System. We've been talking about all sorts of breastfeeding, so we just finished up pumping and introducing bottle. But now you're going back to work.
Yes.
Not all mommies get to stay at home, and so it can be stressful. And knowing that you have you don't have to have a freezer full to go back to work.
Not at all.
So when do you start kind of building that initial stash to get going? And then from there, what's kind of the process?
How does that go?
Yeah.
So usually by 6 weeks, 4 to 6 weeks, a mom will start pumping a couple times a day. Some mommies pump more than that, whatever they're comfortable with. It does make moms feel a little bit more secure going back to work when they can see a stash growing in their freezer.
Right.
But ideally, so frozen milk is different than fresh milk in that all of the antibodies in mom's milk don't survive freezing and thawing. So whenever we can give fresh milk or refrigerated, which is considered still alive, we prefer that. So when a mom goes back to work, what she pumps on Monday, baby gets on Tuesday, and it's just in the refrigerator and the warmed ones and still living. So full of protection for baby, which is really important when they're in a daycare setting. And as far as going back to work, the Affordable Care Act of 2012 asked employers to provide a clean, private, secure space for moms in the workplace. It's not a restroom, which is important, and also time to express milk every day. So an 8-hour workday is typically about 3 times, 3 pumps a day, a lunch break and a morning and afternoon break. And if someone's working a 12-hour shift, they might need another time or 2. But yes, that works very well for most mommies.
And so whatever you pump, once you go back to work, what you pump at work on Monday is then Tuesday's milk. Tuesday becomes Wednesday, and then Friday's Mondays.
Perfect.
That's perfect. And that way you still have the weekend to get back to nursing and have that special bonding time.
Yes, and so we do encourage when mom and baby are together, baby at the breast. That helps keep milk supply strong. So that would be evenings and weekends, nurse to get that supply back up tip top for Monday.
Perfect. We do have a question from Amy. She's wondering if you have any tips on how to get through a nursing strike.
Oh, nursing strike can be tricky. So what is a nursing strike? That's when out of the blue, for some reason, baby just refuses to latch and nurse. And it can be really scary and upsetting to mom, and mom's uncomfortable. We know baby's hungry. Typically, it's related to something going on, and we just have to be detectives and figure it out. Often it's an ear infection that may happen, and baby's hurting, and they don't like to lie down on that side because it hurts their ear. Sometimes it can be related to teething, their little mouth hurts. So a variety of reasons. We usually suggest that mom try sideline nursing in a quiet, dark room, try giving milk another way, just keep offering, and you get through it. But it's pretty common to have a nursing strike here or there.
Erin is asking if there's a certain amount of time to have the baby breastfeed on each side, and at some point, when are they just comfort nursing?
Yes. So old breastfeeding information, we really watched the clock. And we said, this was long ago, 10 minutes on one breast and switch 10 minutes on the other, and that's all they got. And that is very old information. So now we really say follow your baby. So in the early days of nursing, when volume in the breast is low, we encourage moms always offering both sides, so they're getting small amounts. Once milk is in, many babies are going to be full on that first side, and they're getting the foremilk and the hind milk, which is the fatty milk. On that first breast, they come off happy and satisfied, then they're fine. So we really follow their lead, just like all the other mammals that aren't watching clocks. That seems to work best. And what was the second part?
The second part is how do you know? How do you know when they're just comfort nursing?
So much of breastfeeding has nothing to do with food. Lots of breastfeeding is about this is my favorite place to be, and I love sucking, and I love my mom's milk, and I feel safe here. And so comfort sucking really is totally a normal part of breastfeeding. If mom knows, okay, we've been doing this for a while and I have things to do, it's okay to go ahead and end the feeding when baby goes into just kind of little tiny sucks like that. You're probably not hearing swallowing and gulping anymore, and baby's often looking sleepy. Then mom could go ahead and end the feeding.
So next question, still on this nursing topic, but now baby's teething. And so Karen wants to know, when baby starts teething, are there any tips you have on how to avoid baby biting?
So yes, so
Yes.
the thing to know with teething is that babies' gums hurt and they're biting on everything. And the other thing to know is that when they are actively nursing, their tongue is out over the gum line, and so they will not bite, because otherwise they would bite their own little tongue. So it's typically at the beginning of a feeding or at the end when they're falling asleep. So moms need to pay real close attention to make sure baby's actively nursing. When they start to slow down and go into comfort nursing, that's when moms will slip them off. And then if they do bite, usually people have a nibble here or there, then instead of pulling them out, we encourage moms quickly bring them in. And that closes off their airway. It doesn't hurt them, but then they will automatically open their mouth, and then we just gently tell them no bite, and we turn them away from mom. We change the activity. Get up, go do something else, and they're so smart. Again, they figure out when I do that, the milk is taken away.
I can't eat then.
Yes, and so they learn very quickly
Yes, they do.
not to bite.
Yes. So, kind of going along the lines of going back to work. So we're gonna switch back here since we've answered a few questions. I found it interesting in one of the groups that I attended when I was on maternity leave. You mentioned when you're pumping or when you're away from baby, the goal is to really keep the breast soft.
Yes.
Talk about why that is.
How that
I
works.
learned why then, so
Yes.
I share that.
Yes.
Why you want to keep your breast soft.
Yep, so the breast refills the quickest when it's emptiest. So it's kind of like an ice machine is how we like the analogy that we like. When you remove ice from an ice machine, there's space, so then it fills again. When the ice machine's full, production stops. So it's really the same with the breast. So when you're back to work, what we want to do is not get to an overly full state.
Okay.
There are little receptors in the breast that sense that fullness and interpret that fullness as we don't need to make more milk at this time.
Stop.
So if a mom is really busy and she thinks I can't pump 15 but I could pump for 7 or 8 minutes, that's always better because she makes space so production continues, and then when she can get to do a full pump, that will work really well.
Perfect.
So, yeah.
We had a question submitted earlier by Kimberly, and she wanted to know, how do you breastfeed with hypothyroidism?
So we work with mothers with thyroid issues daily, really. And the critical thing with mommies with thyroid concerns is that we make sure that their levels are well managed. So it just might mean that they may need to have lab work done more frequently during lactation. And then we always tell them, if you're ever feeling like your supply has decreased, the first thing to do is go and ask your physician to do some lab work on you, and let's see if we need to maybe adjust your thyroid medication. But we have many mothers with low thyroid who make lots of milk and breastfeed long term.
Yes, perfect. Now, we're sickness is all around all the time. And the big question can be, do I still breastfeed a nurse while I'm sick, or do I pump and dump? What do we do?
Yeah, absolutely. Very, very rarely would we have a mom stop breastfeeding if she was ill. So one of my favorite parts about human milk, again, it's dynamic and always changing. Mother senses things in her environment, and she creates antibodies for those viruses and bacteria, creates those in her body, secretes them through her milk to give baby extra protection to, say, the flu if she's been exposed to that. And then it goes the other way as well. Babies exposed to things in their environment, say at daycare when they're away from mom, when they latch on a nurse at home at night, a little saliva of babies travels up in the breast, mom detects that with this virus or bacteria, creates antibodies, sends them back to baby. So there's an amazing just exchange there that's happening. So the best thing to do with illness is continue to breastfeed.
That's fascinating,
It's
by
magic.
the way. It's
Yes,
how
it is.
it's interchangeable, and
Yes.
baby helps mom, mom helps baby.
Yes.
Kelsey asks, if I was an overproducer for my first baby, should I expect the same for my second?
Sometimes yes, and sometimes the body seems to figure it out a little bit and reduce supply. But often moms who've been overproducers, that tends to be their pattern.
Tends to be their pattern.
Yes.
Now, going back to pumping, especially pumping at work, there's a lot of, do I wash my parts in between pumping? How do I handle that? So someone submitted a question and said, I know that combining milk, you want it to be the same temperature. So if it's in the fridge, you want to make sure that the milk's the same. You're not adding fresh to cold.
Yes, cold to cold.
It's always cold to cold. But what about if she's using the same bottles and they're cold? Can the bottle be cold and then freshly pump? or does it have to be a room temperature bottle or a new bottle?
No, we would say always a fresh, clean bottle. That would be wise, just to be very safe.
Just to be safe.
Yes, and then the main thing is same temperature. So room temperature to room temperature is fine. They can combine, an 8 a.m. pump, which could sit out until 11 easily, and then combine milk from that pump in the same bottle, and then chill it all together.
Gotcha.
Works great. Or chill the 8 a.m., chill the 11, and then combine.
Yeah, perfect. Now, Erin is asking a question. She's ending her exclusive pumping journey. Do you have any tips to help with the discomfort?
Yes, so go slow.
Go slow.
Slow. So normally we say it's best not to drop one pumping sooner than about every week. Every 5 to 7 days. And then just go by how she feels. So if she's feeling uncomfortable, then she might want to pump a little just to soften. So that she doesn't end up with a breast infection.
Right.
And then usually she wouldn't want to drop 2 pumps in a row, like maybe not the 8 and the 11, but she would do like an 8 and then maybe a 3 or 4, spread them out a little bit. And just listen to her body, and if she's feeling uncomfortable, pump a little bit to comfort.
Now going back to kind of, we were talking about sickness. There are some resources that moms can use. One, reaching out to lactation consultants. You can help guide through, look up medications, things like that. Are there other resources they can look to kind of help with that?
Yes, so we do lots of phone helping and look up lots of medications, but we don't work usually 24-hour shifts. And so sometimes moms at night in the store wondering, what can I take? So it's wonderful to have an app on their phone. We love the LactMed app, and then we also love Mommy Meds. LactMed is a free app, and it is an excellent resource. And we always look at 2 things when we're looking at the safety of medications, and that is, number 1, is it safe for baby, of course. But number 2, we look at, is it safe for mom's milk supply? So a common question is, what about when mom has a cold or seasonal allergies is really common. So an antihistamine would be fine, but we would typically want to avoid the decongestant, because that could decrease supply.
So it's decongesting up here. Also could be
decreasing
other
milk supply.
That is very interesting. You wouldn't necessarily think about that. We did have a question about a mom having concerns about thinking her letdown is too strong for baby. So what would she do in that instance?
So typically we call that a forceful letdown, and it's very common in the first couple of weeks of nursing when moms just have an abundance of milk frequently. So one thing we do is sometimes have mommies pump off a little bit of milk prior to nursing, maybe 3 to 4 minutes. Sometimes first thing we do is just change baby's position. So instead of being in a lying down position where gravity is just helping that milk just really come quickly, we might do a more upright position so that baby can manage that flow a little bit easier. And then usually by 3 to 4 weeks, we're finding that mom's milk supply has regulated somewhat, and then as baby grows, they also learn to manage an abundant supply. Right.
Now we have another interesting question, which I've never thought about. Can a mom breastfeed if she has breast implants?
Absolutely. Yes. No problem at all.
No problem at all.
No problem at all. So we do encourage that anytime that there is a surgery, we always look at what parts of the area were where there were incisions, because that can be concerning. But in general, most mommies with breast implants breastfeed and make lots of milk. No problem at all.
Great. Yes. That's very good to know. I know that could be a big question for some. And kind of moving on with overproduction. So some moms are very blessed and have an oversupply, but then they don't know what to do with it. So what can moms do when they have that? I don't want to call it an issue, but when they have an overproduction,
kind of a good problem to have.
Yes.
So we have at St. Luke's, we have the Heart of America Mother's Milk Bank, which we are thrilled to have. It was established in 2012, and we are the only milk bank in Missouri. And we love for moms to donate their extra milk to our milk bank. So I think we're going to give the resource for contact and finding out more about that later. But usually we want moms to be about 3 months postpartum, and then their physician, their OB, and the pediatrician need to fax in a letter saying everybody's doing great, baby's thriving, mom has plenty of milk. And then mom goes through screening and has lab work done. Breast milk is tested, it's very safe. And then that breast milk is used in our NICU. And so many babies receive the benefit of that donated milk.
That is wonderful. And if you're interested, feel free to check out our milk bank. But also, if you have any other questions or want to come to one of our wonderful lactation support groups, if you want to join or go to class.stlukeskc.org, and you will find all of our listings and times and locations for our mom-to-mom breastfeeding support group. And if you're going to be a new mom and you want to join one of the breastfeeding classes to learn a little bit more, that's also there for you. Thank you so much for joining us. Thank you, Marji.
Yes, thank you,
and
Marji.
we'll see you guys later. Thanks.